A lot of the way the program has been set up, it creates a lot of perverse incentives to actually keep people in an institutional setting, said Verma, who first signaled in a speech this year that CMS wanted to curb costs and improve quality of life for kidney disease patients through a new payment structure. Indeed, consultants say home dialysis has been slow to take off because doctors prefer to send patients to clinics. The changes pose a particular risk to DaVita Inc. and Fresenius Medical Care AG, which operate more than 5,000 U.S. dialysis clinics and control around 70% of the market. They could also provide an opening for new rivals, including CVS Health Corp., which seeks to offer lower-cost home dialysis, and startups Cricket Health and Somatus, which focus on early intervention to slow progression to kidney failure. We have to be open to what I'm hearing coming out of CMS, that they want to look at different ways for us being paid and how can we really try to create more opportunities for these patients to be better served, Fresenius Medical Care Chief Executive Rice Powell told analysts. The company is expanding in-home dialysis with its $2 billion purchase of NX Stage, a U.S. maker of home-use dialysis machines. Fresenius Medical Care said it plans to convert some dialysis clinics into transitional care units to train people for care at home. It aims to boost the percentage of its U.S. customers using home dialysis to more than 15% by 2022 from around 12% currently. DaVita recently launched new technology, including remote monitoring and telehealth, to improve the patient experience at home and champions home dialysis, a company spokeswoman said. Kidney disease on the rise. Nearly 15% of the U.S. adult population was suffering from chronic kidney disease in 2018, fueled by growing rates of diabetes and hypertension, according to the government's U.S. renal data system. In 2016, more than 720,000 people were estimated to have progressed to kidney failure. That is forecast to climb as high as 1 million people by 2030. DaVita and Fresenius Medical Care offer two forms of home dialysis: hemodialysis, which requires a machine and special filter much like in clinics, and peritoneal dialysis, which utilizes the lining of the abdomen to filter waste from the blood. CMS is considering the benefits of peritoneal dialysis, which is used more widely outside the United States. Peritoneal dialysis machines are around the size of a desktop printer, smaller than home hemodialysis machines. DaVita believes home dialysis could eventually account for up to 25% of treatments if physicians are educated on its merits, and it plans to build fewer new clinics. Medicare pays for home dialysis, but adoption has been slow. Only around 8% of end-stage renal disease patients were on home dialysis in 2016. The U.S. Department of Health and Human Services, which oversees CMS, is also seeking to increase the number of kidney transplants through proposals it hopes will expedite access to organs. More than 20,000 people received kidney transplants in the United States in 2018, a fraction of the more than 100,000 people on the waiting list. CMS has also finalized new rules that beginning next year will offer financial incentives for new drugs to treat kidney failure. CVS is working on its home hemodialysis device with Decker Research and Development Corp., a New Hampshire-based company owned by Segway scooter inventor Dean Kamen, according to sources familiar with the arrangement. Startups including Quanta, France's Physicalidia, and California-based Outset Medical, are working on user-friendly dialysis machines for home use. Cricket Health and Somatus use data analysis to detect high-risk chronic kidney disease patients earlier, educate them on treatment options, and provide home dialysis services. Cricket CEO Arvind Rajan said the government could save money via a flat fee to manage patients earlier in the disease and reward providers who keep costs down. The most profitable thing you can do is keep a patient from kidney failure, and the least profitable thing you can do is have the patient on in-center dialysis, he said.